All right. So, you were telling me about some upper back pain, some shoulder pain that you've been dealing with for a long time. Can you tell me a little bit more about that, where you have it and why?
Yes, so it always starts at my shoulder blades,
Mm-hmm.
and then it will, I mean, I can sometimes feel like a burning sensation in between my
Mm-hmm.
shoulder
I'm going to hand you
blades.
a tool,
Oh, yeah.
and you can reach over your shoulder and show me,
Okay.
like draw it, not where it hurts to touch,
Mm-hmm.
but where you have symptoms.
So it always starts right there
Okay.
on that left side.
Mm-hmm. And it feels good to massage.
Yes.
Does it ever feel worse when you have, like, you go to a massage therapist, or if Will rubs it or anybody
It
else
has
massages
in the
here?
past. Yeah.
Sometimes it can be too much.
Yeah.
Okay. All right.
So it starts here. The left side's always more noticeable.
Okay.
And then here around this
Mm-hmm.
other shoulder blade.
Is that a little lower than the other side, or is it about the same?
It's a little lower.
Okay.
This left side right now, definitely there's some pain there, and it's a little higher up, like it's like right there.
Mm-hmm.
And then on this side, I don't have a whole lot of pain, but like right there,
Kind of cranky,
tender.
tender, talkative.
Yeah,
Does it hurt to take a breath?
no, not
Okay.
right now. It has in the past.
But not recent past.
Not real recent, no.
Okay. Not the last few weeks or last few months.
When I had some neck pain
Okay.
about 3 weeks ago,
Okay.
and it was so bad that it did hurt to take a breath at one point.
It hurt in the back of the neck.
Mm-hmm. And I know exactly what I did. I mean, I know what caused it, and it was stupid, but and it lingered. Like, and that's when I was talking about the trigger point,
Mm-hmm.
when she pressed on it, and then I felt like the pain radiate like through my head.
Mm-hmm.
That was when I had that neck pain back here. And then it traveled down into my shoulders, and it's still not completely gone.
Okay.
And then in between my shoulder blades.
Oh,
now,
right.
I don't have that burning sensation right now.
Mm-hmm. Comes and goes,
But-
different times,
right.
depends on what you do.
Right,
Mhm.
right. Now, when I sit at my desk all day, if I'm not aware of what I'm doing, then I will get that burning sensation by the end of the day, and then it will travel all the way down.
Mm-hmm. And is it a vertical, or is it a horizontal pattern as it comes down here?
More horizontal.
Okay. All right, so I've just drawn basically kind of a picture of what she has described to me. I'm gonna check it out, see if, does that seem right to you?
Yes.
What else? Am I missing anything?
I don't think so, no. No. Now, sometimes at the top of my shoulders, when it's like really bad,
Mm-hmm.
it will just kind of ache.
Okay.
Just ache. And I've even had, sharp pains that will like shoot down into my arms at times. Now, I haven't experienced that in a while, but I have had that happen.
Okay.
Just in case anybody's watching that's experienced that.
Sure.
I have experienced that.
Yes, and things come and go, depends on what you do,
Mm-hmm.
but not necessarily related to an injury, except for maybe, I think you had said that the upper back pain maybe started when you broke your leg.
It didn't start then. I had it before that, but I think that's
it made
why
it
the
worse.
left side,
Yeah.
as always, I feel everything more on that left side than I
Okay.
do the right because of this injury.
Okay.
Because
Right.
it's like the left side of my body. If anything's going on, it happens on the left side.
Mm-hmm.
It's
Yeah.
so weird.
It's all connected, right? So you change this foot has to, you can't walk on it. You have to use crutches. It has to rehab. That all has to happen. You wear the boot, and then your pelvis is all goofy because this boot has got you jacked up too high. Just a tip: wear a shoe that's as tall as the boot, or buy a little thing that fits onto your shoe so your pelvis is level. It will save you weeks and weeks of agony. But then you have all that compensation pattern. You got the crutches, all of that stuff going on, or the scooter thing that you're using, so your body can heal this leg. But then you've got the consequences, right? You've got that leftover. This hip has not been. You've been holding it up, or you've been keeping it, on the scooter, so the hip flexors are all goofy. So, if you're coming to me over time, we're not going to just treat the back. We're going to try to figure out the why. And what's happening with the leg, the foot, the pelvis, the whole body, so we can keep this from coming back all the time.
Mm-hmm.
Now, you get massage, is that right?
I get massages pretty regularly, but that's, just for relaxation. But then I do MFR.
Mm-hmm.
And I was having MFR treatments once every 2 weeks.
Mm-hmm.
And then now I'm down to once per month. And so when I was having MFR twice a month, I did not have any shoulder and back pain. Like it was pretty much gone.
Now, what would happen if she had been out of town, or you'd gone on a simple vacation or something like that, and you missed that 2 weeks? So at week 3 and 4, your back is aching.
If it was a situation where I was sitting a lot at that computer, I would be in pain.
Right.
If I had been on vacation, I had been more upright, moving, walking around, I probably wouldn't be in pain.
And you've had, I'm going to take this tool from you.
Oh, yeah.
You've had a massage. They've focused on the back, the myofascial release, although she's not just focusing in between the shoulder blades, she's focusing further down your back.
Everywhere.
She treats your abdomen and your chest and all that stuff. That's excellent. So MFR, myofascial release, that's excellent. So it's changing that pattern of the fascia. If you don't know what fascia is, have you ever, this is kind of disgusting, but have you ever cut up a whole chicken?
Yes.
Right. And so you're pulling the leg off the thigh, and there's kind of this membrane, this film that you it's not the fat, it's not the skin. There's this membrane. That's fascia.
Okay.
And fascia encases groups of muscles. It's under our skin, and it encases the fat. It's like the bags that hold everything in. And then all of the fibers, there's layers and layers and layers of fascia that hold in the fibers. So if you think of roast beef, as it breaks apart, as it's cooked, that's the connective tissue breaking apart. That's fascia.
Okay.
And that fascia gets bound up and tight and restricted. And it follows, what we do, and scarring and all kinds of stuff that affect these big picture patterns. So the question is, how do we get you to a place where you don't have to have the myofascial release just to stay out of pain and stay comfortable? Or, hey, what if your back felt better so she could move down to your legs?
Right.
Or other areas. So first of all, I'm thinking about how common this pain is between the shoulders. As I mentioned earlier in the podcast, people, just about everybody who called me for a video consultation during the lockdown had pain in the upper back. And inevitably they were sitting at a laptop, they're all crunched forward, and they were really struggling. Many of them had seen some YouTube videos, and they're using the lacrosse ball on the floor, and they're just killing themselves and not finding any relief. And that's because the problem is not in the place that hurts. If it were in the place that would hurt, that lacrosse ball on the floor would help, right? But and the massage would help, and it would change it, but it just keeps coming back over and over and over again. So first of all, the easy thing to do is obviously to treat where it hurts. So say somebody's not had massage before, they've not tried any of these things. The things that they can do, they could get a tool like the Theracane. These are available on Amazon. I'm going to hand you that.
Okay.
Right. So say you're new to this and you just want to massage. You could take your tool, you can massage through the upper back, all of that stuff. If you're not solving the problem, like it comes back in 10 minutes, half an hour, 2 days, and you're just having to massage that area over and over, you go, okay, well, what refers pain here? And there are a bunch of muscles that refer pain there. There are muscles behind the shoulder blade that refer pain to the back. There are muscles in the front of the neck. And this is the most common one. And a simple thing that we can do, that we can all do without having to know anything, other than the first rule of massage is we don't massage a pulse.
Okay.
Okay. So I'm going to teach an easy one in the scalings. So I have my collarbone here, and I'll have you feel your collarbone. And right here in front, as I turn my head, you can see this big, strong muscle. There it is. This has a fabulous name, the sternocleidomastoid muscle. So right here, she's got a wonderful SCM muscle. It turns the head. Just on the outside of that muscle, just above the collarbone, I'm going to press down. I'm going to have her relax her neck and turn back to neutral here.
Okay.
And so I'm going to have you take your little finger, and you're just going to reach in behind the collarbone here. Is this tender here?
A little bit.
Okay.
Oh, yeah.
All right. Now let's put that on a number scale of 1 to 10. So, 0, no pain, 1, tiny pain. 10 is the place where you're yelping ouch and trying to get away.
I mean, this is probably at a 2.
Okay, great. So I'm going to increase it a little bit. I'd like to go up to a 5, and we'll call 5 your perfect level of pressure, where you don't want any more, but you don't want any less. You're able to breathe normally and relax. It's a little bit painful, but you like it. Therapeutically delicious.
That right there it's starting to feel pretty intense.
Okay.
I mean, I could handle more.
Of course.
Yeah.
Yeah, you could take it. And certainly if I said, this is going to solve your problem, you'd be like, bring it on.
Bring it on.
This is not no pain, no gain. This is, oh, it's okay, little muscle.
Yeah.
You don't have to work so hard right now.
So this is considered what I'm feeling right now. We're at like a 5.
No. Is this, let's see, so let me describe it like this. Do you want more pressure or are you still able to relax?
I'm able to relax.
Mm-hmm. Does it, if I pressed a little harder?
That's pretty intense right there.
All right, look at her face. See, she's squinting her eyes a little bit.
Mm-hmm.
That's like a 6 or a 7.
Oh, yeah.
Yeah. Now, when she starts to grimace her face, that's a 7.
Mm-hmm.
8 is statements that you're thinking like, oh my gosh, that really hurts.
Mm-hmm.
9 is you're thinking swear words.
Yeah.
All right. And 10, you're thinking about calling me swear words or
Yeah.
trying to get away. All right. So that's the scale that we're on. So let me have you take the middle finger of your left hand and put it right here where this spot is.
Middle finger of left hand. Okay.
Now you've got some good nails.
Yeah.
So I'm going to have you bring that in right here.
Okay.
So right next to this, I'm going to show you here. So I've got my sternocleidomastoid.
Mm-hmm.
I can really see it, and you'll be able to see it in the mirror. And I'm going to be just to the outside of that and above my collarbone.
Okay. So I'm just going to press in just like you did, right?
Mm-hmm. Yep. And for do you feel a pulse there?
Yeah.
Okay. So I'm going to have you move. I'm going to touch it again.
Okay.
Very shadowy, very light. And if I move over here, I feel it more. So I'm catching the subclavian artery. So I'm going to move around a little bit until I'm off of that artery.
Okay.
So right there. So let's have you just kind of fine tune that. And if you're worried about whether or not you can feel the artery, so if you pour salt on the tabletop, can you feel the salt on the tabletop? Can you feel it between your fingers? If you can feel that, you're going to be able to feel a pulse. All right.
I can't feel a pulse here.
Okay, great. All right, so that's a good spot to massage. Is that tender?
It is.
Okay.
Yeah.
Now the direction of pressure, you can press down towards the floor from this position.
I feel it in my right shoulder.
Okay. So back here.
Mm-hmm.
All right.
More like right at the top.
Okay.
Yeah, it's
Right
like, yeah, I can feel it. Mm-hmm.
So the scalenes have a referred pain pattern that goes down the arm, into the forearm, and into the first finger and thumb, and then let me have you turn all the way around.
Okay.
And it makes pain here as well. This is the most common cause of pain in the upper back. Period. Okay? Most common cause of pain in the upper back, the scalenes, the referred pain from the scalenes. You're feeling it through here. Sometimes people are going to feel it in their armpit a little bit. Maybe turn back around.
feeling it too on the back side of my right arm.
Yep.
Right
here.
there. Yep.
Yep. So let's look up the scalenes.
Yeah, that's wild.
That's the referred pain pattern.
Because when I let up, that just completely goes away.
So this is the book that our book is based on. So the red is the referred pain patterns. And then the X's are where you're commonly going to find the trigger points. So you're on
that is
spot
really
right there,
something.
right
Yeah.
where that collarbone is.
So how long would I stay in this position?
Such a great question. So one, you follow what feels right for your body. In our book, we're going to say, stay on the spot for less than a minute.
Okay.
You could do a moving stroke from one side of the pain to the other, maybe 10 to 12 strokes. There's a lot of different theories about how to do it. Commonly, people, used to press and hold. Ergonomically, for self-treatment, that press and hold technique is a lot of work for people who are not used to doing massage. So we developed a technique of of a moving stroke. What's most important is you do what's right for your body. So, and that, this arm gets tired, right, of doing that work.
Right. I was getting ready to ask about that.
Yeah, you take a
Because my
break.
middle finger is already like, kind of achy from just holding it there.
Right.
Yeah.
So then when you come back to it in a minute, maybe you use a different finger. You don't want to use a tool. You don't want to use a Theracane. You don't want to use a knobble. You don't want to use anything like that on the front of your neck. You want to use your fingers so you can stay off the subclavian artery.
Okay.
And so you can stay off of the carotid artery. So where do you find the carotid artery? Right here, just under the chin and on the neck. Now you can safely massage all of this stuff, but you just got to stay off the arteries.
Gotcha.
And my book details exactly how to do this, how to find it, how to stay off the artery, and how to treat this safely.
Okay.
Okay?
Okay.
All right. So this scalene spot right here, so you could come back and treat that on yourself. If we were having a longer session where I could teach you in detail how to come up the front of the neck and treat the scalene as it's all the way up here, how to treat the middle scalene, so if we find that SCM that turns the head and this big, beautiful muscle right here, we turn our head back to neutral. Just where my fingers land behind that, I'm on the middle scalene, and that's a safe place to massage.
Okay.
All right, so I could massage just right here on the very side of my neck. I think of this as the 50-yard line, okay? So if this was the end zone and this was the end zone, I'm on the 50-yard line. Do you agree?
Yes.
Okay, so I can massage all the way up here, all the way down to my collarbone. And I'm looking for little tiny spots that are exquisitely tender, and I'm just going to give them a little bit of love. I would use this hand.
This one?
Okay. So then we can really pinch that SCM. So as you turn your head to the opposite side, so turn towards me. There you go. You'll see and feel this SCM. So if you're doing this in the mirror, you'll see that SCM pop out, right?
Now I've got it.
Yeah, isn't that great?
Yeah.
So now you're going to come back to neutral with your head.
Okay.
There we go. And then where your fingers land, just here on the side of the neck, right? That's the middle scalene. And we describe in the book how to make sure you're on the middle scalene. There are brachial plexus nerves that run through here. In general, the nerves don't care unless they really care. And we would know because she would have yucky pain going down her arm. Yucky pain. Not like it aches sometimes, like a toothache. It would be severe, and I would go, what's happening with the structure, the bones, the discs, stuff like that.
Oh my goodness. This is like, this is, oh my gosh. Like incredibly tender right there.
So this is excellent. So stay on that spot, lighten up a whole lot. So what a trigger point will do, it will go from 1, 2, 3, 7, 8, 9. A nerve will go 0, 10.
That went 0, 10.
Okay, excellent.
Yeah.
So hold that spot and relax a second. Okay, there we go. Yep. Now, when you're on that spot, is it tender right now?
Yes.
Okay, but it's not a 10.
Not a 10, no.
Right. So we've been able to bring down the pain. What is it right now?
I'd say I've got that arm pain going on.
Got the referred pain here?
Oh, yeah.
Okay.
Definitely a 5. If I went a little harder, I think it would.
Like kitchen scale, like adding grams and ounces a little harder. Right. Then it gets yucky.
Yeah.
Yes.
Yeah.
That's a trigger point in the scalenes.
Oh, yeah. That's unbelievable. Okay.
Yeah, and this is your cranky side.
Yes.
Okay, so now we're going to give it a little love. So literally it's like, it's okay, little muscle. You don't have to work so hard right now. I literally say that. I say that to myself because here's the thing. You're in pain and you're tired of it, so you tend to want to beat it up.
Right.
Don't do that. It's not helpful. This muscle is connected to your nervous system. So how do we get things to calm down when they're overwhelmed, like a baby? Or your dog or your cat that's sick and overwhelmed and freaked out. You don't yell at them.
Right.
You don't touch them aggressively and move them around. But when we're trying to calm them down, we touch them gently. We use a soothing voice. We calm down. So our brain can literally amplify the pain and make things worse by how we're thinking about it and the stress. We can amplify it. And we can turn it down. Like the mothers that lift the cars off the children. And like we can turn the pain down so far that we can do amazing things to push through, to survive, to rescue, to do what we need to do. But for this, we want to pay attention to the sensation and we want to treat it at a level that feels therapeutic, but not too much, just gentle. It didn't happen overnight with this, and it's not going to go away overnight.
Right.
So let's treat it at a level that doesn't bruise, that we can come back to repeatedly and give it a little love. Okay, so your fingernails are kind of long, right? And, you might be committed to them for a while. If you, for example, decided that you really wanted to treat your scalenes on yourself, you might have your nails short and filed very short for a few weeks while you get your scalene trigger points under control, because it's going to feel really uncomfortable, and you're not allowed to use a tool. You have to use your fingers.
Gotcha.
Okay.
Is it a bad idea to use?
Nope, you can use your knuckles. Anything that it may be ergonomically not quite as fabulous, but we can find other ways to treat with your fingers.
But fingertips, that's best practice.
Yep, I might do this on this side. Fingertips. I might do my knuckle if I have to. Coming down here, I could use my thumb in this position. Just staying off of the pulse. That middle scaling is super easy to treat on yourself. And you can bring it all the way down here to the collarbone. Or you could walk across just above the collarbone and get all those little spots.
Okay. Okay.
Okay. Any questions?
I don't think so. That was fabulous. I can't believe that when I pressed in that area, it's hard to describe, but it did go from 0 to 10, and it was like a pinch, like a weird pinch.
Do you mind if I treat it on you?
Oh, I don't care.
Right,
no, go for it.
So first thing, I'm going to find your sternocleidomastoid. All right, so scale of 1 to 10.
Woo!
Yucky.
5.
Oh, she said, ooh, and a 5. So we want 5 to be perfect. Is that still too much?
It's not too much, no.
Okay, all right. So I'm not using a ton of pressure, but just enough. And then I'm going to let go of that SCM. I'm going to press on this scaling just here and behind in the middle scaling.
Okay.
So I'm going to work really slow. Anybody tender in there?
A little bit, but not too much. But it's like, it can just like kind of happen all of a sudden.
This is good stuff. This is palpable. So that you have a palpable middle scaling, which means it's living taut and cranky.
That makes sense. Okay. Yeah,
Right there?
Yeah.
So then I'm going to go from one side of the pain to the other, and I'm going to see, I don't feel your sensation. I don't feel your pain. It'd be very handy if I did, but I don't. I can go in whatever direction is most effective with the least amount of effort. So is it, is it this direction? Is it this direction? And what I'm doing is I'm staying on the same piece of skin, and I'm moving down. I can move up. I can move forward. I can move back. On self-treatment, you can really, you're like, oh, that's the exact angle. That's the exact direction of pressure. I'm just guessing and watching and asking for feedback. Yes, ma'am.
So I think up and down.
Okay.
I mean, just like the first time doing this, that feels like it might be more effective.
Like that. So I'm going to give that spot a little love, and then I'm going to get out of the way. The body is doing the work. It's changing the biochemistry. And
yeah, I
can
feel that.
For anything else that's tender. Yeah. And then keep coming down. So I can be really thorough. I might take 15 minutes to really explore through the scalings, or longer. Or I could take a minute, and it's going to be beneficial and helpful. This was one of the first muscles I learned to intentionally massage on myself, because I was a mess when I was about 23. I'd had a back injury that I had acquired when I was 18. I think if I had gone to the doctor, they would have diagnosed me with fibromyalgia. I don't think that's what I had.
Right.
I think I had widespread myofascial pain that we solved. All the way down here.
Ooh.
Okay, right here?
Yeah.
Okay, let me have you do something else. So I can prove that I'm on the muscle that I think I'm on. So I'm going to have her take a staggered breath. So it's going to look like this. You only get to do this a couple times, and then you have too much oxygen. So you blow out all your air, and then you sniff through your nose 10 times until you can't breathe anymore. It goes like this. And we get into chest breathing. Keep going. So you blow out all your air. Staggered sniffs. Keep going, keep going, keep going, keep going, keep going, keep going. And I feel the muscle contract under my fingers. That's how I know I'm on the scaling.
Do I hold my breath?
Nah. There we go.
Ooh, okay.
So we just get, and that was a little bit, it made it more intense, didn't it, when you contracted it? So that's another way. If you're on so I'm on a trigger point, I'm on a muscle, I'm like, gosh, what muscle is this? Make it do its action while you're pressing the trigger point. When you contract a muscle that you're holding the trigger point, it will be more intense on the trigger point. It'll hurt worse. And you go, okay, yes, for sure, I'm on that muscle I think I'm on.
That is so interesting.
So we're just going to give it a little love. Okay.
So now I've just put all the pieces together, because when you learn how to do this on your own, then you are going to figure out pretty quick what works and what doesn't.
Yes, you can't fool yourself.
You can't fool yourself.
Yep.
That is fantastic.
Yay.
Yeah.
Excellent. Okay, so I think your scalenes are involved with your upper back pain. So I would want, if you were coming to see me, I'd give them a really good, thorough treatment. If you were far away and you just had the book, or maybe you're a regular client and you've called me and said, Amber, I'm on vacation in Bermuda and help me out. I'm going to teach you how to massage all 3 sections of that muscle safely, effectively, in a way that you feel confident about, so you can treat it regularly, daily on yourself, maybe 2 to 3 times a day. If the tissue starts to feel bruised and cranky, you leave it alone. Let it calm down.
Okay.
If we're doing this in an ideal kind of way, maybe we heat it up first.
Okay.
Do the massage. Maybe you don't get it done 2 or 3 times a day. Last thing you do before bed, do the self-massage, and you feel better in the morning.
So you can do this lying down, standing up,
Yes.
sitting, in any position?
Find the easy way. So for me, if I'm finding the easy way to treat my scalenes, I'm going to support my other arm and I'm going to sit at a desk. I'm going to find my SCM, I'm going to press on my scalenes, and I'm going to work all through here, just as lazy and easy as I can.
Okay.
So that's the most common place that's going to refer pain. It's also a little harder to learn how to massage on yourself, but you're going to want a resource, not just a drawing from the internet. You want a resource that describes exactly how to do it. The Trigger Point Therapy Workbook is one of those resources. Another thing to do, like you said, you're sitting at the desk, right? And that myofascial release work really works well for you. So I think we should also learn to treat your pec muscles and probably your abdominal muscles. So I'm going to hand you one of our tools.
Okay.
So I brought a couple of different things. These are Theracanes, and I really like these for working on the chest on myself. So I can use my little handle. I'm going to work through the cloth so it doesn't abrade my skin.
Is it a good idea or a bad idea to use massage oils?
I don't use massage oils for self-treatment because I'm using the tool through the cloth. Yeah, and I want to be able to do it wherever I need to do it. I think if we add massage oil, then it's the whole thing.
Okay.
All right, so then we're going to find a way to make this even easier and lazier. So I'm going to make my opposite side hand be the main tool.
Opposite side here?
Yep.
Okay.
So put this hand all the way
up here?
Yes, ma'am.
Okay.
Yep. And then this hand can drive the tool, but it doesn't have to work. So right now we're working on the pectoralis major, and I don't want the pectoralis major to do the work right now. I want the opposite side to do the work.
Okay.
So I can kind of stabilize this tool. I can work all the way from the collarbone. The pectoralis major comes all the way down here to the abdomen, all underneath the breast tissue, the sternum, the collarbone, and attaches to the arm. And its job is to move this arm over here. So what do we do all day long?
Right.
We cook. We do everything out here. So our pecs get a ton of work. They're overworked and underpaid. You go for a massage, you get all this work in your upper back and your pecs, and then it's like, oh gosh, breast tissue, scary, right?
Right.
Well, you can teach, maybe you don't want somebody to touch your chest. You can treat this on yourself. All right, so you're going to have a tool like this. You can have any handheld massage tool like a knobble or anything else, and you can just use this to massage. You can work on yourself. You can work through the breast tissue as long as it feels comfortable to you. So if you find a spot that feels yucky, that feels cranky, that you can't make feel a 4 or a 5, get off of it. It doesn't want massage.
Yeah, this feels really, really cranky in here. Like more so than I would have even thought. I mean, it's like tight and yeah, that's something else.
Yeah, so you're going to give it some love.
Yeah.
It's okay, little muscle.
So when it feels like that, you just need to leave it alone. Is that right?
I would love it. I'd love on it.
Okay.
So I'm talking about what I mean by yucky is you go to touch it and it goes, no, I don't like it. And you go to touch it softer and it's like, doesn't hurt. No, I don't like it. You listen to yourself. You go, okay, yucky. But if you can make it feel therapeutically delicious, comfortable, a little bit painful, but you like it, you might also use a different tool. Maybe that one is too intense. Let's try the knobble.
Okay. We often let our minds run the show when it's our bodies that tell us what we really need to know.
Yes, listen to your body. You can always do too little. You can always do too little and see if you get away with it.
Right.
So this tool I really like because, one, it's wood and it's going to biodegrade. So I have 3 surfaces. I have this one, and this one. This is made and sold by a company called Pressure Positive. So pressurepositive.com is a great place to get massage tools, including the knobble.
Okay.
So I can use the edge of it and drag it and massage all through here. And then this arm is just going to chill out. So it could be in your pocket, it could be in your waistband, it could be on the desk. And if this was a lot of work for this other hand, I could add it in here. But in general, I want that pec to relax. I could add stretch to it if that felt good and appropriate.
Okay, so this is a move that a person needs to do when they have the shoulder pain.
Yeah, and in between shoulder pain.
And in between,
yes.
okay.
So like, yeah. So I mean, all of us probably need chest massage to help open this up. We're spending time here.
Right.
This is short and tight. So you could massage it anytime that's convenient for you to help be able to pull those shoulder blades back.
Okay.
That we've learned all kinds of really great stretching and strengthening exercises, the doorway stretches, you know, the pulleys to strengthen the rhomboids, and that's great. But if the tissue is taut, we need to soften the tissue and then stretch it. This is a missing piece. Soften the tissue, lengthen it, then stretch it, and it will maintain that length. If your stretching is not working, soften the tissue with massage and myofascial release.
Okay, that's good to know. It makes so much sense.
It's not rocket science.
Right.
So another thing we wanted to talk about was the breath, right?
Yes.
So the scalenes in the neck are an accessory breathing muscle. That means that their job is to raise the first two ribs to make space for the lungs to expand. And we have a whole lot of muscles that do that. It would be ideal if we were breathing with our diaphragm, which looks like expanding your tummy when you breathe. So if I'm going to do an abdominal breath, I fill my tummy with air, which means I let my tummy get bigger, with the risk of everybody think I'm fat, which is God forbid, right? So that's really deeply ingrained in us, especially women, but also men, right? We're not like, I'm supposed to be like this.
Just be holding it in, right?
No, we have uteruses and bladders, and we have enough, right? We live in a time and a place where we get to have a little insurance against starvation. So
right.
So just, breathe, right? So just breathe. So we get to expand the abdomen. So this is really hard for some people because we hold in the abdomen, we feel stressed, we crunch our diaphragm, so we breathe up here. So people who've sung, people who play wind instruments learn how to do diaphragmatic breathing to get more air. So becoming aware, hand on the chest, hand in the abdomen, expanding the tummy to breathe, let the belly button float, so like laying on your back, let your belly button float up to the ceiling, and then as you exhale, pull that belly button in towards your spine. Not super overachiever, just pulling it in towards the spine. You could pull the pelvic floor up at the same time if you wanted to get an idea of what I'm supposed to be feeling. You might touch your lower abdomen, getting a sense of that, and then breathe and expand that tummy again. Yep, and this hand is going to monitor that chest breathing, and so we're really before we get up here, because one of the things that can overwhelm the scalenes is making them work all of the time. So coming out of the chest breathing into more habitual diaphragmatic breathing. Expanding that tummy on the inhale, on the exhale, drawing it in. Yep. So you can really see your neck muscles contracting as you're breathing. So this coming into awareness with your hands, especially laying down in your bed, kind of a quiet time, coming into noticing your breath, is you get enough air, get enough air with the abdominal breath. Don't allow the chest to expand. Just training that body. You can also put your hands on your rib cage and go, okay, I want this to expand when I breathe. And that brings your awareness into the rib cage here. So this is important for a lot of different pieces. The breath, getting the transverse abdominis to stabilize, getting the diaphragm to do the breathing, rather than the mover muscles that we should save for moving, the scalenes and the serratus anterior and these other things. And our abdominal muscles get really cranky. You had talked about a pattern that goes across your back like this.
Yes.
Right? That is a referred pain pattern from a trigger point here in the abdomen. So what do we do when we get at the computer? We bend in half, we do this, we get stressed, we get cranky, all of those things. You can get the referred pain, and you can also get your spinal erector muscles, those vertical muscles along the spine, to get cranky and tighten. They'll yell at you too. So what I want you to do is I want you to just press into your abdomen. So we're going to find the center here, the xiphoid process. We don't press on that bone at the very bottom of the sternum. We just come just down from it and to the side, and we have the ribs come through here and through here. And what we're looking for, and you just let your tummy be nice and loose and relaxed. You're pressing in and looking for anything tender through there. So I'm making a gang of fingers, as my dad would call it. I'm trying to get all my fingers on the same place.
Left side right there is very tender. Right there.
Okay. All right.
Mm-hmm.
So now,
significant difference from the right.
So let's focus on that left side for a minute. So I want you to tune into that sensation and tune into what your face feels like. When you notice yourself start to squint your eyes and hold your breath, think of that as a 6. So you need to lighten up the pressure so it's a 5. Now, if it feels so yucky you don't want to do it, just treat it up to a 3 or a 4.
Okay. So I'm just going to keep pushing until...
Just going to love on it a little bit.
Ooh, okay. Yeah.
So you could just do that conscious relaxation while you're working there. You can breathe and exhale. Yep. And then after a little bit, you can expand that search up onto the rib cage a little bit more, into the attachments and the fascia of the rectus abdominis, looking for anything else that's tender and love on that.
And again, I felt that pain radiating both across here and here.
So I'd want to unpack that. Now, typically this trigger point doesn't refer to those areas, but then I would say, well, is she using a muscle that does refer to these areas? Is this the tension in the trapezius up here? Is she holding her breath? Is she doing the chest breathing to avoid the pain here and overusing the scalenes? So I try to unpack that a little bit. Or it's also possible that that muscle on you refers pain there, and that you just are exceptional, as we know.
So yeah, I mean, that is really something. How there's nothing over here. But then here, and I would have never thought to find that on my own. I mean, that is just crazy.
Yeah, this one's life-changing.
Yeah.
So this one also causes headaches by the posture. So you sit all week at your desk, preparing for a workshop, you're teaching with your dad, and you feel kind of stressed about it, right? And then you go and you stand up in front of people, holding your tummy in,
right?
Right? All of that stuff. And then you end up with a headache. So it took me a while to figure out, for me, this is a headache because of this posture and the stress. So when I get a headache, one of my best practices is to massage my rectus abdominis, my whole abdomen. This muscle's the 6-pack. It goes all the way down to the pubic bone. I could treat this whole thing. I could do a tummy squeeze where you're pressing and squeezing. There's all these techniques in the book about how to treat this. You can treat your own pubic bone right above the pubic bone here. And that makes a pain that goes across the low back like this.
Interesting.
Yep.
So all we do is we just explore.
Could explore.
Until we find a tender spot.
Yep.
And then we press in on it.
Yep.
Until it gets to the point of a 6, and then we want to lighten up. And then
Go
hold that for less than a minute.
Yeah, go for a 5, and then come back to it. You might come back to it 2 or 3, 4, 5 times a day. You want to listen to your body. You don't want to bruise it and make it cranky.
Okay.
Now, how do we know that I'm not pressing on your stomach and your stomach is mad, or your small intestine, or your guts, right? Right? That's an important question.
Right. Yes, it is. Yeah.
First of all, we want to remember that our bodies are made to grow babies, and those babies get big, and they kick us in the bladder, and they kick us in the nerves, and all this stuff, and it's fine. And then all of that contracts and expels a baby. So first of all, these are not delicate structures that we're likely to hurt. There's one piece of evidence. Then think of the gymnasts, like we just had the Olympics, right? That bar is going across their abdomen. So on a healthy body, it's going to be okay, right? We're not going to harm them with our own hands. Not too likely. And we listen to our bodies. So if I'm pressing a spot and it goes yucky, or my intuition goes, I don't think that's a good idea, then I'm going to listen to that. If I press in and it's yucky and I can't make it nice, I stay off of it. It could just be gas, right? I might come back to it later and go, is that spot still tender? Do I need to ask my doctor about this? Is this not good? I might notice that. And of course, I listen to myself. And then there's another idea. So I press into a spot. It's not yucky, but it's tender. And I think, well, how do I know that this isn't my guts? So imagine I'm lying on my back on my bed. I can raise my head and shoulders up while I'm pressing on the spot. I can raise my head and shoulders, I can turn myself to the left, I can turn myself to the right, and I'm contracting the rectus abdominis, the external oblique, and the internal oblique in turn. If that spot goes away while I'm contracting, doing that little sit-up, it's deeper than the muscles. The muscles are protecting that spot that's tender. Then I might go, okay, we'll leave that alone.
Okay. Excellent information. God, yeah. That is just so...
And all that's in the book.
Yeah, that is something else. So when someone is using this book here, so in the back...
Let me show you.
Yeah.
So I'm going to start with, because we have all these muscle names, it can get overwhelming. So first thing I might do is I might start with the index, because it's broken down into areas of pain. So let's talk about chest and abdominal pain, for example, or maybe I want to go make sure I'm going to the abdominal muscle. So it's chapter 7. I'm going to turn to page 155. And this is where we get into the dysfunction stuff, right? So let's say that we've been having, maybe our massage therapist, or maybe on the video, you're like, hey, we should go treat the abdomen. We come here to this section, and then we have the pain guide. And the pain guide is going to tell us which muscles refer to which areas of the body. So chest pain, other parts of the abdomen, and it's going to give us a page number. We could also turn and go through the other symptoms guide, talking about different types of pain and other symptoms, nausea, for example. Testicular pain is in here, difficulty with urination, all kinds of stuff. And then we could flip and we could see all of the drawings from this chapter here, and we can compare the referred pain patterns. So in our book, the dot is where the trigger point typically happens, and then the little slashy horizontal lines are the referred pain patterns. It'll tell me what page to turn to, and then I turn and look for, there's the pectoralis major. So there's our pec major. You were just treating those trigger points right there. Typically cause pain in the front of the shoulder, but also do that dysfunction of rolling you forward, making it difficult to keep those shoulders back easily. Then we've got a section that talks about the symptoms, talks about the causes, and talks about how to do the self-treatment, like we just did.
Okay, I mean, this is absolutely fabulous. See, this book is like so easy to use. That's why I wanted to give a little demonstration about how to use the book. When someone gets this book, then they can just jump right into it.
Jump right into it. And in our next edition, we'll talk more about the dysfunction. We'll talk about more about how to put all of these pieces together. This book is very thorough on each muscle, how to find and treat each muscle. And I've added, with this 3rd edition, more figure it out tools, what's going on. It's rarely one muscle. It's usually multiple muscles involved. And you work through it and you figure out, okay, what is the most important thing? But this book is less than $30.
Right.
The Theracane is $30, $35. That's cheaper than what you can get a massage for.
Right. No pills, no bills, no appointments.
Now, ideally, if you're seeing a massage therapist, you're seeing a PT, okay, so what's the most important muscle that I should be massaging? Take the book in with you. Talk to your massage therapist. If your PT wants you to stretch your pecs, massage your pecs. Talk to your practitioners about what you're doing at home. Is this appropriate for you? Is this a good idea for you? What can you do to support what they are doing in the clinic?
Okay. So do we have anything else?
Well, like I said, I could talk all day, but I'm going to hand this back to you.
I mean, I think that we have just started to change the world, if you want my honest opinion. I mean, this is really, really, really incredible. And I have known so many people who have lived with chronic pain. And for those who are watching right now, chronic pain is defined by a pain that lasts for 3 months or longer, right? It's the 3 months?
6 months, yeah.
3 to 6 months. Okay, so then that would put me in that category.
Yeah, you have chronic upper back pain.
Right.
Right. So what else can we do? What else can we do to see what is the role of muscle in this problem? Are there trigger points that are contributing to that pain?
Right.
We'll find out.
Yeah. So I hope you guys have enjoyed this. I know that it's going to help you. Please look up Amber Davies, buy the books, try these treatments.
And if you need some help, reach out.
Yes.
NewDayMyoPain.com.
There you go. Now you know who to ask.